Dr. Weiland, thank you so much for joining us again today. We're talking about RSV today. It's pretty big here in Mississippi and probably amongst other states as well. But of course, we're going to talk here about the city of Vicksburg.
Correct. Respiratory syncytial virus, RSV, is not new. It's been around. It was actually discovered, the virus was discovered in 1956, so it's been around, or that's when it was noticed. It's here every year. It usually is, we find RSV infections about the same time we have flu infections. Respiratory syncytial virus is a virus that causes an infection of the smaller airways, the bronchioles, and can lead to bronchiolitis, which causes wheezing. Now, the issue with RSV in adults is not usually much of a problem. You have cold symptoms, you get a little cough, you might cough for a couple of weeks, but our biggest problem is in the younger children. Once you get smaller, younger children, you have more problems with wheezing, pneumonia, that kind of thing. RSV is the leading cause of pneumonia and bronchiolitis, which is the small airway infections of children less than age 1. Most children by age 2 have had RSV. They've had it. They build up some immunity to it. They build up antibodies to it. And the next year when they get it, most of them don't get as sick. So our biggest problem is in children less than age 2, especially less than age 1. And specifically less than age 6 months, we see a much larger chance of being in the hospital, getting pneumonia, getting sick, ending up in the ICU on a ventilator because of their small airway size. Now, I brought along something to talk about that.
Yes.
Generally, if you think about it, we have a very large airway. Our airway, you can see, this is our biggest airway, and after that it goes down in size until you get to the bronchioles, which are the little B airways, right before the air sacs. Well, in children, their largest airway, so when you look at a child, think about this, their largest airway is only about as big as the diameter of their small finger. I brought along an ET tube. If you're unfortunate enough to need one of these, this is what we put into your windpipe to help you breathe if you have to have assisted ventilation. So either we're bagging you, we put you on a ventilator, we're helping you to breathe. But you can see how tiny this is. This is something that would be used on a child less than age 6 months. Maybe the bigger 6-month-olds, we might go a little bit bigger than this. But basically, it's very tiny. And this is why they have problems, because their airways, this is their biggest airway. This goes in their biggest airway. It goes in that one right there.
Wow.
And because it doesn't take very much for that twitchy airway to keep them from moving air, they do have a tendency to get more pneumonia and wheezing. And in children, especially less than age 6 months, their symptoms last longer, sometimes for weeks. They wheeze audibly, sometimes for weeks.
So with, we're talking about RSV today. COVID is still a big issue. How, obviously the two, they don't mix. Let me just say that, which is, because if they mix, it just wouldn't be good at all.
Correct.
How does that work?
Well, you know, we are able to test for RSV. We have a test for respiratory syncytial virus. We have a test for COVID. And usually, whether you're in the emergency room or you're in our office, we'll check you for both. If we hear wheezing, it usually is more the RSV than the COVID. COVID does a lot of things, but RSV is the one that usually causes the wheezing because it causes the twitchy airways and the very small airways.
What are some things that parents can do to prevent RSV?
Well, it's really the same thing as preventing any respiratory illness. You don't get around sick people. If your child's sick, you keep them home. We've had a real problem here in Vicksburg for the last few months, and what's kind of interesting is, you know, the last 3 months or so, and this is mid-August. So what I'm saying is RSV this year started in the summer. It's usually a fall, winter, spring problem. But because children less than age 2 weren't around each other very much until now, they're sharing those germs when they go to daycare, when their siblings go to school, they bring it home to the little ones. And we just really, over the last 2.5 to 3 months, have seen a ton of RSV.
And so it may look like, so more seasons have been added pretty much. So
well, it will be interesting. Well, I think what happened Marcus, is that those children last year that were at home and not getting around other people and their siblings weren't in school, they never got it. So this year they're getting it. So we had so many more children getting it because they didn't get it last year and they didn't build up any immunity.
That makes sense.
Now we talk about monoclonal antibodies for COVID, and there is monoclonal antibodies for RSV, but it is only administered to a very select subgroup of children who have underlying health issues such as heart disease, if they were extreme prematurity, children who would end up in the hospital in intensive care if they got RSV. And those children who qualify receive a shot once a month during RSV season to protect them from getting RSV or to help them to keep from getting it.
Now, obviously, it's not best for parents to keep their children at home to deal with RSV themselves. What are some things that they can do, though, if they're at home and they realize, okay, my child has gotten RSV again for a second, third, or fourth time?
Most children will build up some immunity after they receive RSV, and only children who have underlying health issues, asthma, that kind of thing, may have problems with it year after year. Most children will develop some immunity and won't get as sick, and remember, their airways will get bigger the next year, so they won't have as much mechanical issues. It's really the same thing. You stay at home if you're sick. The same things we do for any other respiratory illness is what you do for RSV. It's out there. It's always been out there. Again, as I mentioned before, parents can get it and they just get a cold, and but of course they can give it to their child. And we know that you'll have some benefit in breastfeeding moms and in young babies if mom has had RSV and has antibodies. But for the most part, the child has to make their own antibodies and develop their own immunity.
That makes sense. Well, thank you so much for your time today, Dr. Weiland.